And so the whole debate was, is this the time in which government ought to expand its role and pay for all this health insurance? The big cost, the $1 trillion cost, is really the expansion of health care and the subsidies for those who can't afford to do it. But it also is a recognition that unless everybody has health insurance, all of us that do have health insurance end up paying. So it was a pretty straightforward argument. Now, some of you are sitting out there saying, why couldn't they explain this to us this straightforwardly? And it's because they got caught up in the weeds on the debate. And because some people who didn't want it at all and didn't want to see any kind of government expansion wanted to simply confuse people, which is a usual political tack. And because it was, in fact, an expansion of government. It was a fundamental debate about the role of government and whether this is an appropriate role for government. I respect that because most of the important things that we debate in this country are about whether government should do this or whether individual families should do this or whether companies should do this or whether institutions of all kinds should do it. So it was really a debate. Should we spend this amount of money in this economic downturn? I saw it as a second stimulus, of course, because they were investing in a dynamic sector where a lot of our students are going to end up getting jobs in the healthcare sector. Or people argued, hey, shouldn't we take on healthcare costs first? The argument against that was it's hard to take it on unless everybody has coverage. It's hard to take on those issues. And second, we have no way of putting together that politics right now because we're going to take money from someone to spread it around to others. And are you prepared to take on the doctors and the nurses and the health insurance companies and the academic health centers and the hospitals at the same time? And so in many ways, the administration took an easier route, and that is they took on the expansion issue first. And most academics in this field would say, expand health care first, get our numbers straight so we know what we have, and then we'll see what we have. Now, how does the expansion, let me take a few more minutes and tell you how does the expansion affect us. For those of you who have family members that are going out into the workforce and are taking jobs where they don't have insurance or are working 2 or 3 part-time jobs, which a lot of people do now, more companies are dropping their health insurance, particularly small and medium-sized companies, because those companies just can't afford to go into the market and get insurance. It's very expensive when you have a small company to go into the market because you can't spread the risk over a large number of people. During the middle of the Clinton debate, they sent me up to Detroit to talk to the small businesses. And I thought I did a pretty good job convincing them that they all should have health insurance. But they were, really giving me a hard time. Finally, someone stood up and said, all of my employees have health insurance. I run a small business, and I don't want your government health insurance. I said, this is great. All your employees have health insurance. You're doing the right thing. Look at this person. She said, no, I don't provide the health insurance. She said, all of my employees have spouses who work for the auto industry. That's cost shifting. And every automobile in this country has about $1,400 built into its cost that a Japanese car doesn't have because they have very heavy health insurance costs in the auto industry. So those are the two bookends. Those are the two bookends. Either we're all in this together, either we all provide health insurance. And what the new bill does is it basically says if your employer doesn't provide health insurance, it does have some requirements where the employer is going to have to pay into this state pot to help subsidize your health insurance. Or if you're working a number of jobs or you're self-employed, you're going to be able to go into a kind of purchasing cooperative and purchase health insurance. That will not affect employees of the University of Miami. You actually will not be allowed to go do that, even though some of those health insurance plans will be cheaper because we're not allowed to let you off the hook. That is, so far, though, we haven't seen all the rules. They also said in the bill for employers that we want you to keep your kids, the children of your employees, on your health insurance until you're 26. That does affect the University of Miami. More importantly, we not only will keep people on until they're 26, they don't have to be in school until they're 26. So they can be out racing cars. We're going to have to cover them. We expect that to affect about 500 employees' kids. And in fact, that takes place in January. And I think that what we're doing is what we usually do every year is we go in and we audit the books and we throw the non-students off of our health insurance. We're not auditing. Is that correct, Narissa? We're not going to audit. We're just going to leave all those kids on who recently graduated or finished graduate school. We'll leave them on. And then during open enrollment, you'll be able to put whatever kids you have onto our health insurance. But we think that we're going to probably pick up 500 more people who will be covered for the first time. Now, it also helps us in the other way, and that is a number of our graduate students and some of our seniors will definitely be covered by their parents now. So if there was an age limit and someone was 23 and still an undergraduate here at the university, they'll be covered by their parents' plan, and so they won't have to buy student health insurance, and we will narrow down the group of people who are buying student health insurance here at the university because a larger number of people will be covered. Now, there are some complex issues there, but we will be giving all of you information about that. In addition, there are a whole set, now that's one of the things that's occurring right now. If you have elderly relatives that are on Medicare, the Medicare program, particularly the drug benefit for the Medicare program, which is called Part D, has something called the donut hole. My mother yells at me about it all the time. If you reach a certain amount of your spending, suddenly you fall into this hole and you have to pay a lot more until $5,000, and then the government pretty much picks it up. My mother thinks it's the stupidest thing the policy people ever designed. The reason for it was that they ran out of money and they were designing a plan, and since most people spend less than $2,000 a year on their drug benefit, they're going to start giving people $250 checks to make up some of that gap and to help seniors. That will not placate my mother, but by the time she's 105, I think we're going to close the gap completely. So I told her to hang on for a few. She's happy to hang on for a few years. If you know my mother, you know she'll hang on for a few more years. Mostly it's prevention benefits, and basically covers almost all of those prevention benefits. Our health care plans have long covered a whole set of prevention benefits. These are mandatory for everyone. So the major change that most of our employees will see immediately is the 26-year-old rule. That's the only thing. I wouldn't worry about it. Just make sure that members in your family who can be covered, that you're putting them on for that rule. And then there are a whole bunch of prevention benefits. Most of the other elements aren't going to kick in for 2 or 3 more years. That is, the choices people are going to have at the state level. As you know, there's a court case. I don't think it's going anyplace. At the setting up of these plans, there are some other things in the bill, eliminating pre-existing conditions, eliminating caps on your health insurance. We simply have not had that in any of our plans. And while I could go through that in detail, because we have not had caps, because we have always covered pre-existing conditions, none of those things will affect our employees. So as a university, we're in pretty good shape, but you pick up the benefit of the 26-year-olds, particularly those that don't have jobs. You'll be very enthusiastic about picking them up. The choices that people are going to have from the states have not been fully designed. There will be a special plan for young people that are going directly into the market that won't need as much health insurance as others, but for the most part, they'll be pretty comprehensive plans at a pretty good price. What the relationship is going to be between large employers in those plans isn't completely clear, but my view is we have health insurance because we want to take care of our employees and because we want to be competitive. And so that will not change for large employers like universities or large private corporations. They provide health insurance as part of their benefit package because they want healthy employees, but more importantly, when you get right down to it, because they want to be competitive. Because the people they're competing for can get good health insurance from other and have other options in terms of employment. So that will not directly affect us. This is a giant step in terms of health policy and social policy. Someone in the press called me the other day and said, they're holding up the HHS budget because they want to defund the implementation of these plans. Well, number one, they always hold up the HHS budget. I don't think we ever got our budget on time. Number two, it is true that only 50% of the American people are now supportive of the reform as they understand it. But at the end of the day, as we get closer to everybody getting coverage, we are going to have a lot of uncomfortableness about this mandatory coverage, that people have to pick up health insurance. And I just would remind you of the two stories that I told you, that about cost shifting, that all of us ought to be in favor, particularly if we're trying to keep our costs down here at the university and trying to expand coverage. We all ought to be in favor of everybody being required, as long as there are proper subsidies, because frankly, you can look someone straight in the eye, and I have people that complained to me about this and said, hey, either you pick up your health insurance or I got to pay for you, because that's exactly what the argument is. Let me end right there, and I'd be happy to answer any questions you may have. Did I cover everything, Narissa, that I was supposed to? Okay, thank you. I didn't look at my notes, so I'm guessing. Thank you.